Right, veterinary nurse class is in session, so I'm going to explain it to you. So what is DCM? So DCM is dilated cardiomyopathy. Now cardiomyopathy, cardio means heart, myo means muscle, and pathy is disease. So it's a disease of the heart muscle. Now DCM is if you imagine something dilating. So you can also get something called HCM, but HCM is more prone in cats and DCM is more prone in dogs. So as it dilates, if you imagine something dilating, as it gets bigger, the heart muscles actually stretch. And once the muscles have stretched, they don't function as well. So as the heart's trying to pump, it's not strong enough to sufficiently pump blood around the body. So the heart has to work twice as hard just to be able to deliver the blood around the body. What will happen then is obviously over time the heart having to work so hard just to pump blood, and obviously the disease is still going to progress. The dogs will then go into congestive heart failure. So a lot of people think that overnight the dog has developed DCM, when actually what happens is DCM can silently progress over so long until the heart's unable to mask the symptoms. Until the heart stops masking it and it's unable to properly function, then the dog will go into congestive heart failure. So congestive heart failure will be the symptoms that you'll then see. So it's more prone in giant breed dogs, so a couple of them will be Irish Wolfhounds and Great Danes. What some of these owners do is they'll take their dog to a specialist every year, and they'll have a heart scan, so they'll do things like an ECG, and they'll do other checks, and they'll see whether or not the dog has DCM. In that case, you can start either putting them on treatment and managing the disease early enough to hopefully alleviate a little bit of the pressure off of the heart and hopefully delay them obviously going into congestive heart failure. So sometimes people think you put them on this treatment and they're like, nothing's happened, it's not changed anything, when actually it's prolonging the animal's life, if that makes sense. But taking your dog to the vet every year as well for the booster, so the vets always listen to their heart and see whether or not they can pick up anything like an arrhythmia, which is if you want to know what an arrhythmia is, I could do another video, or if they can pick up a heart murmur. If you also want to know what that is, I can tell you. Taking them in for the regular boosters is really good because the vet does a full check and listens to them, and they can hopefully pick up signs of early heart disease, so that if you need to do anything, you can do to prevent it from progressing. So I hope that makes sense. I hope that was a good explanation. But anyway, have a really good day and keep your pets safe.